Hi, my name is Roxanne Derkson and I'm a registered massage therapist for 30 years, and I've been practicing the Feldenkrais Method since 1996 when I graduated from a training in Montreal, 4-year training, and it's been the one thing that has kept me practicing as a massage therapist. Every day I'm still really excited about teaching people how to move better. And that's why I'd love you to come to my course. My Feldenkrais Fundamentals for Functionally Focused Treatments is level 1 and level 2. And on June 1st and 2nd, I'll be teaching here in Victoria, right in my clinic space actually. The classes are very small, and it'll be here, and you can register online. We have an online store that has workshops on it, or you can give us a call on 250-298-4484. I also teach a Saturday morning class from 9:30 to 10:30 where I teach an awareness through movement lesson, and it lasts for an hour, and you'd be welcome to come and just check out my teaching before the class if you're wondering what it's all about and if you haven't experienced it. So we have $5 off coupons. You could drop by the clinic anytime on Oak Bay Avenue, 1976. And right now, this is Marissa. She's an RMT who works at the clinic, and I just wanted to do a quick demo. So this second level is focused on the pelvis and how it is kind of a gateway towards the lower extremities in terms of movement and functionality of the body. And a lot of times people come in and they're not standing well on one hip, and they have trouble because their IT bands are really tight or they've got muscular tension. And so the best way for them to learn how to improve the rotation and movement of their legs is in lying down, where they're out of gravity, so they don't have the gravitational kind of forces on them, and that means that they're not moving in a more habitual manner. They're more open to learning. And I'll be showing you this in my training. Just a quick demo now is to just feel from the hip joint, you know, at the top of the femur, how much rotation is happening in the person's legs. So say if they're cycling and they've got some problems because they're actually overflexing and extending the knee and not really driving that downward movement through their hip and pelvis. Or say if they're running and some of their running is too lateral and they're not really, you know, kind of elevating themselves as they're moving. This is a really good technique to help your client get more in touch with their hip joint. So right now I'm rolling her hip joint internally, and then I'm going to just stabilize her whole leg by just kind of turning the entire leg in, and then ask her, you know, can you rotate your hip outwards now? And then I'm just observing where the movement's coming from. So she's feeling it too because I'm giving her some feedback. I'm kind of like acting as a constraint here, and I'm just sort of feeling. And then a lot of times what you find is if people have one hip that like is too externally rotated or doesn't turn well externally, that often what they'll do is they'll over rotate their ankle and they'll over push with their foot, right? So if you have a sense of that, you can kind of point that out, and then you just get the person to hold here in the hip and then start to roll your leg to the side. Can you do that, Marissa? And then just roll your leg to the side and feel your knee bends, right? I mean, it has to bend, right? It goes to a place where just functionally it has to start to bend. But now what you want to do is actually draw your knee out farther towards me. So you're bending from your knee. And often if people start to have trouble in their hip joint, what they'll do is they'll start bringing their heel up. They'll start using their lower leg to kind of dominate and bring it up. But what you want is that full sensation of the rotation in the hip. Can you feel that? Yeah, so I just get somebody to kind of come and they rotate out like this, and then they straighten. And again, you know, the straightening needs to come from here, right? And so the focus needs to happen, right? And so you get the person to do that a few times, and then you have them come back and you rotate again, and you just, already we can actually see that your leg is moving better. That's really funny. That wasn't a plant, actually. We didn't have this. But anyway, Yeah, really, it's super exciting actually if you can help people in a fairly quick way, reconnect themselves. We always talk about, it's not firing, muscles aren't firing, things like that, but this is a way to kind of get in touch with what's not moving and help people, in a dynamic way where there's more planes of action going on than just one. So come to my class. I'd love to meet you and teach you, and we only have 8 people in the class at once, and there's definitely room in the June class still. Thanks for listening.